focused on occupational and environmental hazards, toxicology, radiation exposure, with 4 answer choices and explanations. Occupational and environmental hazards, clinical vignettes. 1. Lead poisoning in a factory worker. A 42-year-old male who works in a battery recycling plant presents with fatigue, abdominal pain, and wrist drop. Blood smear shows basophilic stippling. What is the most appropriate next step? A. Serum iron studies. B. Venous blood lead level measurement. C. Vitamin B12 level. D. MRI of the brain. Answer: venous bleed level measurement. Explanation: lead poisoning is common in industrial workers. Symptoms include anemia, neurotoxicity, and abdominal pain. Organophosphate poisoning in a farmer. A 55-year-old farmer presents with salivation, lacrimation, diarrhea, and pinpoint pupils after spraying insecticide. What is the best initial treatment? A. Activated charcoal. B. Atropine and pralidoxime. C. N-acetylcysteine. D. Deferoxamine. Atropine and pralidoxime. Explanation: organophosphates inhibit acetylcholinesterase, causing cholinergic toxicity. Atropine blocks muscarinic effects. Pralidoxime regenerates acetylcholinesterase. 3. Mercury toxicity in a lab worker. A 27-year-old lab technician develops tremors, mood changes, and gingivitis after working with broken thermometers. What is the most appropriate next step? A. Hemodialysis. B. Dimercaprol or succimer. C. Methylene blue. D. Glucocorticoids. Answer: B. Dimercaprol or succimer. Explanation: mercury toxicity affects the nervous system. Chelation therapy with dimercaprol or succimer is recommended. Radiation exposure in a nuclear worker. A 34-year-old nuclear power plant worker presents with nausea, vomiting, and bone marrow suppression after accidental radiation exposure. What is the most appropriate treatment? A. Deferoxamine. B. Potassium iodide. C. Atropine. D. Hematopoietic growth factors. Answer: D. Hematopoietic growth factors. Explanation: acute radiation syndrome damages rapidly dividing cells, including bone marrow. Treatment includes G-CSF to promote WBC recovery. 5. Arsenic poisoning in a metal worker. A 50-year-old metal worker presents with hyperpigmentation, stocking glove neuropathy, and Mees lines, white lines on nails. He reports drinking well water near an industrial area. What is the best treatment? A. Atropine. B. Deferoxamine. C. Dimercaprol, Bell, or succimer. D. Vitamin B6. Answer: C. Dimercaprol. Explanation: arsenic exposure leads to skin changes, neuropathy, and nail abnormalities. Chelation therapy is the main treatment. 6. Carbon monoxide poisoning in a firefighter. A 30-year-old firefighter is found unconscious in a burning building. His pulse oximetry reads 100%, but he is cyanotic. What is the best next step? A. Administer methylene blue. B. Administer 100% oxygen or hyperbaric oxygen. C. Order an arterial blood gas. Give activated charcoal. Answer: B. Administer 100% oxygen or hyperbaric oxygen. Explanation: carbon monoxide poisoning causes tissue hypoxia by displacing oxygen on hemoglobin. Pulse oximetry is unreliable. Treatment is 100% oxygen or hyperbaric therapy. 7. Asbestosis in a shipyard worker. A 65-year-old retired shipyard worker presents with progressive dyspnea. Chest X-ray shows pleural plaques and interstitial lung disease. What is the most likely diagnosis? A. Silicosis. B. Asbestosis. C. Berylliosis. D. Farmer's lung. Answer: B. Asbestosis. Excellent. Asbestosis is linked to shipbuilding and insulation work. It presents with pleural plaques and interstitial fibrosis. 8. Silicosis in a quarry worker. A 53-year-old quarry worker presents with progressive shortness of breath. Chest X-ray shows upper lobe nodular opacities and eggshell calcifications of the hilar lymph nodes. What is the most likely diagnosis? A. Asbestosis. B. Silicosis. C. Berylliosis. D. Coal workers' pneumoconiosis. Answer: B. Silicosis. Explanation: silicosis is seen in quarry workers, miners, and sandblasters. Upper lung nodules and eggshell calcifications are classic findings. 9. Cyanide poisoning in an industrial worker. A 40-year-old man working in a plastics factory collapses at work. He has cherry-red skin, confusion, and metabolic acidosis. What is the best treatment? A. Sodium thiosulfate and hydroxycobalamin. B. Activated charcoal. C. Potassium iodide. D. Pralidoxime. Answer: A. Sodium thiosulfate and hydroxycobalamin. Explanation: Cyanide poisoning inhibits cytochrome oxidase in mitochondria, leading to cellular hypoxia. Treatment includes sodium thiosulfate and hydroxycobalamin. 10. Benzene exposure and leukemia risk. A 60-year-old chemical plant worker presents with fatigue, easy bruising, and pallor. Lab results show pancytopenia. He has worked with solvents and benzene for 30 years. What is the most likely diagnosis? A. Multiple myeloma. B. Acute myeloid leukemia, AML. C. Aplastic anemia. D. Chronic lymphocytic leukemia, CLL. Answer B. Acute myeloid leukemia. Benzene exposure increases the risk of AML due to bone marrow toxicity. Pancytopenia is a classic early sign. Key takeaways for occupational and environmental hazards. Lead poisoning. Battery workers, basophilic stippling, wrist drop, treat with chelation, EDTA succimer. Organophosphate poisoning. Farmers, cholinergic symptoms, treat with atropine and pralidoxime. Mercury poisoning. Lab workers, tremors, mood changes, chelation with bowel or succimer. Radiation exposure, bone marrow suppression, treat with G-CSF. Arsenic poisoning. Skin pigmentation, neuropathy, Mees lines, chelation therapy. Carbon monoxide poisoning. Firefighters, normal pulse ox, treat with 100% oxygen. Asbestosis, shipyard insulation workers, pleural plaques. Silicosis Miners, sandblasters, upper lung nodules, eggshell calcifications. Cyanide poisoning, cherry-red skin, metabolic acidosis, treat with hydroxycobalamin and sodium thiosulfate. Benzene exposure, chemical workers, pancytopenia, AML risk. Would you like more case scenarios on specific occupational